As a physical therapist, I get asked all the time, why is it so hard to bend my knee after knee replacement surgery? Why is it so stiff? Why did I have the knee replacement surgery to still have pain afterwards? Well, I am going to impart some wisdom to you today. I'm going to share the most important thing that you need to know that can result in a faster and less painful recovery after knee replacement surgery. And yes, it is possible. Now, you have probably heard that the exercises are the most important thing after the surgery. Or maybe you've heard that icing your knee is the most important thing, or elevating your leg, or taking your pain medications on a regular schedule, or the physical therapy is the key to your success. Now, I'm not saying that these things are not important for your knee recovery. I'm saying that I don't think they're the most important. Now, I'm going to apologize in advance for how long this video is, but I think this information is so important. I believe that you're not told about this, and yet it directly impacts your knee recovery and your overall satisfaction with the surgery. So let's get to it. What is this one thing that I am talking about? It is the neurological component to knee replacement recovery. I know. What does that even mean? What is neurological recovery? It means that your brain will control your knee recovery. I want you to think about it. Just because the surgeon goes in and removes the bone with these arthritic changes does not alter the fact that your brain has been protecting your knee for years. It knows what movements cause your knee to lock up, which ones cause it to buckle, or which one will cause a sharp pain. All of this is simply not erased from the brain's memory because you had knee replacement surgery. Okay, I'm Shehla Rooney. I'm a board-certified specialist in physical therapy. I have over 25 years of experience. My sole focus for the past 5 years of my career has been on knee replacement recovery. Why is that important? Because it makes me a specialist. I'm sure that you're not going to a surgeon who does a couple of knee replacement surgeries a month. I hope you're choosing a knee surgeon that does a high volume of knee replacement surgeries per month, like maybe 20 or more. That makes them a knee expert, and you will have better outcomes because of their expertise, because they're doing knees every single day. And the same thing applies to physical therapists. We get better at what we do every day. Now, I've been solely seeing knee replacement recovery patients for the past 5 years, and I have learned a lot. I have seen a lot, and I have heard from thousands of individuals just like you who have been told they need a knee replacement surgery or they've already had one. And the one thing that I consistently find that you have no idea about is this neurological component to knee replacement recovery. And yet, it can be the difference between whether you get back to doing the things that you want or not, and how fast you get to do that. And yet, we health professionals do a terrible job of explaining this key concept to you. Now, I'm telling you that this is the key to the recovery. Once your brain trusts your new knee, your recovery will go smoothly and you will progress rapidly. So please stick with me for a minute as I explain this. Now, I don't know if you know this or not, but you have what is called chronic knee pain. Now, chronic means pain that has lasted longer than 3 months. If you're watching this video, it means you're considering knee replacement surgery because your knee pain is getting worse. It's impacting your daily life and the ability to do the things you want to do. People do not consider knee replacement surgery unless they've had pain for months, years, some for decades. This means you have chronic knee pain. Now, I'm explaining this concept because chronic pain is treated much differently than acute pain. With acute pain, you strain your knee while playing pickleball this weekend, maybe with some ice, some elevation, and some rest, it gets better. Your brain really doesn't change. But with chronic pain, your knee that has been bothering you on and off for decades, it could be because of a knee injury that you had in college, maybe a car accident years ago, something like that. Either way, you started changing your behaviors years ago. Now, some people know it, some people don't, but you might now sit down to put your socks and shoes on, or when you're putting your pants on. Maybe you're going up and down steps one leg at a time. You've probably stopped doing some activities, like maybe you no longer garden or don't golf. Maybe you stopped walking with your girlfriends because of the pain. And why did you do all this? to avoid further aggravating your knee pain. So understanding this concept of chronic knee pain will help you with your knee replacement recovery. So before I get started, I have to give you a quick history lesson on what is pain. Pain is a good thing. It can alert you when something is wrong. We know that the brain is always looking for potential threats, and its number one job is to protect us. When we are young, and we've not really experienced pain, we have what's called normal sensitivity. But after the onset of pain, we have what's called elevated sensitivity. This means the protective response is quicker, and it will alert you to potential danger earlier. So let me explain what I mean by that. Think of it like this. I like to describe pain like a smoke alarm. When a smoke alarm goes off, it does not necessarily mean that there's a fire. It could mean that we're doing a systems check, or maybe there's burnt crumbs in the toaster. But with chronic pain, the brain immediately thinks that the house is on fire, worst case scenario. So what does that look like? Let's say I was to show you a stovetop that has one of those eyes that turns red when it gets hot, and I tell you that I'm going to take your hand and I'm going to place it on the red eyelet of the stove. But don't you worry, it's not connected to heat. Nothing bad is going to happen. Well, as I guide your hand towards the red stove, your brain would be very hesitant. It would be cautious. It would not willfully let me place your hand on the stove. The reason being, your brain remembers that this is dangerous, and therefore it will try to protect you. Now, the same thing applies to your knee. Your brain will not let you do tasks that it perceives as threats to your knee. And the longer you've had knee pain, the more threats the brain remembers. And the next thing you notice is that you are doing less and less because your knee pain is getting, worse and worse. In the healthcare world, we have a term for this. It is called fear avoidance. It means the avoidance of movements or activities based on the fear of increased pain or re-injury. So sometimes you just stop doing things because it might hurt your knee and not necessarily because it does hurt your knee. What if I told you that it wasn't actually your knee pain that was getting worse and that instead it was your brain saying that the house is on fire every time you do anything involving your knee? Now, I'm not saying that your pain is not real, and I'm not saying that your fire alarm is going off all the time, but I'm saying that sometimes it doesn't need to go off. I am saying that if you can reset the fire alarm to not go off when there is just burnt toast, and to only go off when there is real danger, then you will see benefits to your knee. Now, some of you are thinking, the doctor told me that my knee is bone on bone, and that is why I have so much pain. It's the worst knee they've seen. But what if I told you that I could x-ray 100 random people tomorrow off the streets, and that 95% of them would show a bulging disc or degenerative disc disease of their spine, but be completely free of any pain or symptoms? And that's a true fact. The point I'm making is that pain is not always associated with the amount of tissue or bone damage. It is based on your brain's perception. If your brain thinks it is going to hurt, then it is going to hurt. Imagine if your fire alarm at home went off all the time, even when there's nothing to be concerned about. How aggravating would that be? So in essence, that is what is happening with your knee after knee replacement surgery. Okay, some of you are thinking, I don't understand what she's saying. I don't believe her. So here's my great example I give my patients. There's a guy on a construction site, and he's holding a nail gun, and it accidentally goes off, and this long nail goes through his work boot, and it comes out the other side. Obviously he's screaming in pain. His buddies rush him to the emergency room. They immediately take him back. They get x-rays, they page the surgeon on call, and the whole time, this guy is in excruciating pain. They get the x-rays back, and it shows that the nail has gone between his first and second toes. Didn't even break the skin. And as soon as the doctor showed the guy that the x-ray, that this is what happened, and he's like, oh, what a lucky son of a gun you are, that guy's pain went immediately away. So the reason being, because his brain got new information that told him that the house is not on fire. It's a false alarm. So he went from screaming in pain to no pain. That is the power of the brain. And if we can get you to understand, really understand how chronic pain works and what your brain's role is, like if we can impart knowledge that the pain you have been experiencing with your knee involves a component of hypersensitivity of your brain rather than solely degeneration of your brain, it will positively impact your recovery after knee replacement surgery. So how will it do this exactly? Well, by understanding your brain's job being to protect you, but also realizing that your brain's signal related to your bad knee is not working right, well, then you might be more likely to push yourself through your pain, with the exercises and the movements that we're telling you to do. Because you would know that the pain you're experiencing is partially related to a faulty fire alarm and is not because you are hurting your new knee or causing further damage. Many people will say they can't do the exercises because the pain is so bad, so they stop or they ease up, both of which will slow their recovery. And all it does is reinforces to the brain, yep, the house is on fire. Instead, we want your brain to feel safe, and we want to tell it that the house is not on fire. Instead, yeah, there might be some burnt crumbs in the toaster, so be careful, but you can proceed. It's safe. And if you fully understand this concept, then you will push yourself a little harder. You won't stop as soon as the pain starts. You'll realize that your brain is telling you that this should hurt really bad, so maybe you should stop. But you have a choice, and you can slowly work your knee and show your brain that the house is not on fire, and so it can relax a little bit and let you work on this knee. The result is improved knee range of motion. You'll see your quadricep muscle activate quicker or work quicker. Your pain will be less and less, and all of this will make you more motivated. It'll make you more compliant. It'll want you to work harder to get this new knee doing what you've always dreamed what it would do. But let me tell you what I see instead. This is what typically happens. All right, let me give you a scenario. Miss Jones has been dealing with chronic knee pain for years. She's been modifying her daily routine. She's doing less and less to protect her painful arthritic knee. She's heard all the horror stories from her friends, the online support groups that she has joined, and she is scared of the surgery. But her surgeon says, this is the only thing that can fix your knee because the arthritis is just too bad. So she reluctantly decides to have this major elective surgery with the hope of this better life. The orthopedic surgeon, he does a surgery and he says, oh, it was a success, Miss Jones. But Miss Jones's leg is now swollen and painful and it won't move or bend. And the orthopedic surgeon sends her to physical therapy. Well, when the physical therapist places their hands on her painful, swollen knee and say, relax, Miss Jones, so that we can stretch you, all her brain hears is, the house is on fire, so protect, guard, because this is going to hurt. Her brain doesn't trust her new knee, and it definitely doesn't trust the therapist's hands. So Miss Jones cannot relax. She cannot allow the therapist to do these necessary exercises, and it's not her fault. Well, then what happens? After the physical therapy session is over, she goes home. And what happens when she gets home? Well, because of her increased swelling and pain, which will probably further get more painful, more swelling that evening, her brain clearly did not like what happened in the physical therapy session. She probably won't be able to do her home exercise program effectively because of the increased pain. Every exercise will result in increased pain. And now she's worried that she may be hurting this new knee. And so that makes her even more cautious. Now she goes back to the physical therapist a couple of days later for her next session. And the therapist tells her that her range of motion is worse than the first day. And again, what do? We start stretching and cranking all over again. And now her brain is reinforced. The house is definitely burning down. The therapist might even lecture Miss Jones about how important it is to do her home exercise program. You need to work really hard on your knee at home because you're not progressing like you should. I hope we don't do that, but reality. So why is it that her new knee is not working? The answer is because her brain cannot forget all the pain she has experienced. And again, the brain's number one job is to protect her. Think about it. 24 hours before her surgery, her brain was still limiting her It was telling her to avoid anything that could make her knee pain worse. So why would you think 24 hours later that her brain would simply let her aggressively stretch her knee beyond what it has been doing for years? I mean, just because she had surgery? I don't think so. The brain does not forget. It is the same reason that you won't let me take your hand and put it on a stove that has a red burner. Even though I'm telling you it's going to be okay, you're not going to burn yourself, your brain doesn't want to do that. Now, if Miss Jones doesn't understand this neurological component of knee replacement recovery, and nobody has explained it to her, what's she going to feel like? She's going to feel like a failure, like a wimp, because, why can't she just relax and breathe like the therapist is telling her to do during the exercises? Her recovery is not going to go the way she thought it should or would. So now what? She's frustrated. She's aggravated. She's disappointed, maybe even angry, resentful. Why did she bother having the surgery if she was just going to still have pain and still walk with a limp? I mean, what was the point of it all? That, my friends, is the typical journey that people have after knee replacement surgery. I mean, it is sad, but it is true. And if you don't believe me, join one of these online knee replacement support groups and listen to everyone's complaints and their journey and their issues. There is a consistent theme. And now, I am here to tell you that there is a better way. What if Miss Jones understands this neurological component of knee replacement recovery? How might her recovery look different than the typical one that I just described? Maybe she'll tell the physical therapist to not put their hands on her new surgical knee because she knows the brain doesn't trust their hands, and the brain sees their hands as a threat and will only support the theory of the house is on fire. What if, instead, Miss Jones asks the physical therapist to show her what she can do herself to her knee so that she has more control of her pain? Miss Jones's brain trusts that she will not cause harm to herself. So even though she might push herself through the pain of a stretch, her brain will realize over time that the pain is not getting worse and that Miss Jones can bring the pain on with exercise, and then it goes away or diminishes once the exercise stops or eases. All of this is teaching the brain that the house is not on fire. And as the brain relaxes its protection of this knee, then the less pain Miss Jones is going to feel and the more motion her knee will gain. Now, do you know how I know this? Because during your surgery, the orthopedic surgeon is going to bend your knee all the way and straighten it all the way a few times. So why is it a few hours after the surgery you can't do that? It's because your brain was turned off by anesthesia during the surgery, so it couldn't protect your knee. But as soon as your brain came out of anesthesia, it immediately went back to knee protection mode. And that's why your knee won't move. I mean, the same principle applies to MUAs or manipulations under anesthesia. What is that? Like if your knee gets stiff and it is not progressing after 4 to 8 weeks, then your surgeon's going to talk to you or possibly recommend an MUA. And what does he do? He takes you back to the operating room. He puts you under anesthesia, AKA shuts your brain off, and then rapidly moves your knee through a full range of motion. The point is, if you can turn your brain off from protecting your knee, then you will have more knee motion. It really is that simple. The key to your recovery is not the surgeon and not the therapist. It's you. The orthopedic surgeon's role is to fix the structural problem of your knee joint. The physical therapist's role is to educate you on what exercises to do and guide you through the process. But ultimately, the onus falls on you. You are the key to your recovery because your brain trusts you. It will allow your muscles and soft tissue to relax more and guard less during the exercises, especially if it knows that you're in control of them. So can you see how your knee recovery could suffer if you don't fully understand this neurological component? Meaning, if your fire alarm is uber sensitive and it is going off with every single exercise you try, then your muscles are going to resist and guard and protect and ultimately inhibit your ability to gain more knee motion. This results in a longer, more painful recovery with less than desirable outcomes. None of what we want. So what is the key to a smooth recovery after knee replacement surgery? Obviously, understanding the neurological component. once your brain determines that the house is not on fire, it will let your knee do more and more before the fire alarm goes off. And soon your fire alarm will stop going off altogether because your brain will realize that it no longer needs to protect this new knee. So, I mentioned at the beginning of this video that my specialty is knee replacement recovery. Now, I know it's sexy and glamorous for a lot of people, but I didn't purposely set out to be a knee replacement expert. I had a patient about 5 years ago, and he was struggling after knee replacement surgery. Now, he was young and healthy and motivated and compliant. By young, I mean low 60s. He was doing everything right. I was doing everything right and everything that I knew to do, and yet his knee wasn't bending like it should. And the surgeon said, he'll likely need an MUA, a manipulation under anesthesia. Obviously, the patient did not want another procedure. And as they say, necessity is the mother of invention. I realized there was something missing in knee replacement recovery. And it was the educational component to the patient about the neurological aspect of recovery, and the patient needed a way to do the exercises on their own because their brain did not trust my hands, the therapist's hands. So this is why GoKnee was created. It's a simple knee device that has movable parts that mimic the hands of a therapist. Our device comes with easy to follow, online exercise videos that show you how to perform advanced techniques on your own that we'd normally do in the PT clinic with me present. But you are in control of how much you stretch or move your knee during every exercise. And because there is no risk that the therapist may hurt you, your brain realizes that the fire alarm may be going off, but there is no actual fire. And this teaches your brain to calm down and starts the process of trusting your brand new knee. So in a nutshell, being able to perform advanced exercises every day, multiple times per day, where your brain feels safe, is the key to an optimal recovery from knee replacement surgery. So, if you have been told that you need knee replacement surgery and you want to get back to doing the things that you enjoy, then you need to click here and learn more about GoKnee and the neurological component and how it will enhance your recovery after knee replacement surgery. And remember that your role is to do the work. Treat the recovery after this surgery like it's your full-time job. At least for the first 30 days. And I promise you, you will reap the rewards for decades if you can do that. You waited years for this surgery. Put in the work. Anyway, good luck on your journey, wherever you may be. I hope this information was helpful.